Welcome to class, student. Today we'll be looking at a very important topic titled health disparities. So when you hear the word disparities, what does it mean? It means unequal differences. Unequal something is not maybe resources or health facilities, or things are not equally distributed among a community or a group or population. That is what disparity means. While health disparities means refers to differences in health outcome and access to health care among population group, and it's often based on different factors. It can be based on factors like ethnicity, based on race, based on socioeconomic status, based on gender and location. So today we'll be looking at health disparity, causes of health disparity and its effect. So health disparity represents avoidable differences in disease burden. That means this health disparity can be avoided. So it represents or results it is an avoidable differences in disease burden, injury rate and healthcare resources availability across population groups. These inequality don't occur naturally but stem from a systemic factors affecting communities differently based on social position, identity and location. So this inequality or disparity does not just occur all of a sudden. It's a systemic process is that affects community differently based on social position, identity and location. This disparity are seen when some groups experience high rates of disease, than more death and greater suffering from those diseases compared to others. Like there's this maybe this a community or a location or a state where some groups in that community experience um high rate of diseases, they experience more death, there's high mortality there and greater suffering from disease compared to other community other people in the same community. Like in the case of our country Nigeria, this disparity is influenced by different factors as we stated earlier, based on cultural factors, socio-economic factors, the educational factor. Many factors actually results in this health disparity. So root cause of health disparity based on socio-economic condition, racial and ethnic factors, based on gender dimension, geographic consideration, mental health access, environmental exposures, manifestation of health disparities. The socio-economic condition: limited financial resources, educational opportunities and unemployment prospect directly impact health outcome through multiple pathways including healthcare access, stress levels and exposure to health risk. So where there's limited in terms of socioeconomic condition, when there's limited access to financial resources, educational opportunity, maybe there's high rate of illiteracy in that community and the unemployment rate directly all these factors directly impact the health outcome of the population or the group in that community. And there's true health outcome through multiple pathways including healthcare access, stress levels and exposure to health risks. We also have racial and ethnic factors. Certain racial and ethnic communities experience disproportionate disease burden and barriers to quality healthcare due to historical inequalities, ongoing discrimination and structural disadvantage in healthcare system. We also have gender dimensions. Gender-based differences in resource allocation, healthcare delivery and social expectation create distinctive health vulnerability patterns that affect prevention, diagnosis, and treatment. We also have geographic consideration, where people live significantly influences health through healthcare accessibility, environmental quality, food options, and community resources, creating stark rural, urban, and neighborhood level disparities. Factor is also the mental health access. Mental health services remain disproportionately inaccessible to many communities, with treatment gaps exacerbated by stigma, provider shortages, and insurance limitation. I'll keep that again. Mental health services remain disproportionately inaccessible to many communities, with treatment gaps exacerbated by stigma, provider shortages, and insurance limitation. We also have environmental exposure. Marginalized communities often face greater exposure to environmental hazards, including air pollution, contaminated water, and inadequate housing conditions. We also have manifestation of health disparities. These disparities appear across health domains, from chronic disease rates to mental mortality, cancer outcome, to behavioral health access. For example, low income communities often experience higher diabetes and cardiovascular diseases prevalence due to interconnected factors including limited preventive care, reduced healthy food access, and fewer physical activity opportunities. Addressing health disparity. Effective approaches combine policy changes addressing structural inequality with targeted programs meeting specific community needs. I'll take that again. Effective approaches combine policy changes addressing structural inequalities with targeted programs meeting specific community needs. Increase health literacy empowers individuals, while advocacy efforts advance systemic reform. Sustainable solutions require addressing root causes rather than merely treating symptoms of health inequality. So health disparity in Nigeria, regional inequalities, and border contents. Nigeria demonstrates clear examples of health disparities, particularly along geographical lines. The northern region experiences significantly higher infant and maternal mortality rates compared to southern areas. That's the stark illustration of uneven health outcome across population groups. So Nigeria is an example of a country that is deeply rooted in health disparities, and an example is the northern region, where there is high rate of both maternity and maternal mortality rate. That is infant and maternal mortality rate, which is in contrast with the southern areas. So this suggests an uneven health outcome across population. Understanding health disparities versus health inequalities. Health disparities represent observable differences in health outcome and between population groups. This can be measured through statistics like the disperse disease prevalence, mortality rate, and healthcare access matrix. Health inequalities, meanwhile, refer specifically to those disparities that are unfair, avoidable, and stem from a systemic social and economic factors. They point to the underlying causes that create and maintain health differences. Factors like poverty, discrimination, and structural barriers to resources. So root cause of health inequality, we have educational attainment, employment stability, income level, gender dynamics, and ethnic background. So look at the key differences: health disparity and inequalities and health inequalities. In terms of focus, observable difference in health outcome, while in terms of focus for health inequalities, underlying causes and social injustice. For nature, there's differences in health status or outcome for health disparities, while for health inequalities, there's unfair and avoidable differences in health outcome. In terms of cause, health disparity can be due to various factors like biological factors and social factors, while the health inequalities, so for health inequality, cause is rooted in social, economic and structural factors. Examples of health disparities is higher rates of diabetes in our racial group, while examples of health inequality is lower access to healthcare for individuals with low income.